Hello, my name is Ed Muncie, and I'm the risk manager for the Curran Group of companies. Our companies and our core values have always been deeply committed to the safety of our team members and their families. While we've all been working hard to keep ourselves and our coworkers safe from the operational risks we face every day, we've also been dealing with the risks associated with the COVID-19 pandemic. By working through this with our safety protocols and practices, we've all been able to keep our businesses up and running safely. So whether you work here in Crystal Lake, Illinois,
or here at Global Finishing Solutions in Osseo, Wisconsin,
or here with Talon in San Francisco, California,
or here with Curran Contracting in DeKalb, Illinois,
and here at Crossville Studios in Denver,
or here at Holland in University Park, Illinois.
Aquí, contrato con Curran Contrato en San Antonio, Texas.
or here at Crossville in Tennessee,
or here with Holland Rail Services in northern British Columbia.
or here, working from a home office as part of our program to limit the number of people in the workplace each day. As this pandemic situation continues on, it would be easy to let yourself get frustrated by the changing and sometimes conflicting news and information and guidance that you might hear. It may also become easy to throw your hands up and let your guard down on taking the protective measures that you really should be doing to protect yourselves and others. Make no mistake though, the virus is still very much with us. And as this pandemic situation continues to evolve, we continue to see more areas with cases on the rise. These are examples of why we shouldn't let our guard down, but even more concerning are the examples that hit closer to home.
Hello, my name is Jason Edgar. I am a paving foreman for Curran Contracting. Some of you may or may not know me. I'm just coming here to talk to you about the COVID thing. I'm going to be completely honest. I did not take this thing very seriously in the beginning. I thought it was kind of a joke, the social distancing, the shutting everything down, but it is very serious. I mean, I got sick myself, and my symptoms were really mild. I had slight fever, headache, no fatigue, nothing really major. But my girlfriend right now is hospitalized because she is unable to hold down any fluids or any food. So this thing is really serious. And the thing is, it affects everybody differently. So I know it's tough to try and take this stuff seriously, especially since we don't know too many people that have been sick. But I'm telling you right now, as someone who looked at this as a joke, and again, I didn't think it was a joke. I just thought it was a flu that everybody was, blowing out of proportion. But the fact of the matter is that it isn't. This is a serious thing. We need to practice the social distancing. We need to keep ourselves healthy. We need to, if we're not feeling good, stay away from people. And we're not isolating ourselves to protect ourselves so much as everybody else around us. So, people need to keep that in mind. We need to do this for other people, not just ourselves.
Hi there, this is Chris Shackleford with Crossville Studios at the Orlando, Florida branch, and I want to talk to you today about my recent COVID-19 experience. I was lucky that I did not need to go to the hospital or anything, but I did display symptoms like fever, chills, body aches, congestion. I had a headache that lasted 6 days, and most important, I lost my sense of smell. I was fortunate to get better and return to work this past Monday. It is Friday today, but it has been a week since my quarantine has been lifted, and I still cannot smell, which affects my taste. I can't tell if something smells good or bad, which is kind of dangerous because if there is smoke from a fire or a chemical is spilled and it's dangerous, I won't know. So I hope my sense of smell does come back. I don't know how I contracted the COVID-19 virus, but we all need to be doing our part and wearing our masks, washing our hands, social distancing, making sure that our work areas are sanitized and cleaned. And we need to be doing this not just at work, but in our own lives as well, every day. The COVID-19 virus is real, and we do need to take it seriously. Thank you.
Buenas tardes, mi nombre es Arnulfo Mendoza, trabajo en la compañía de Curran Contracting. No quiero dar un pequeño testimonio de que yo salí afectado del COVID-19. Yo y toda mi familia, amigos, salimos afectados. Nomás quiero decir que se cuiden, que esto es duro, no es un juego, es duro estar aislado de la gente, encerrados. De los síntomas que se cansa, uno es demasiado, pierde el apetito. Gracias a Dios ya estamos saliendo de esta, pero cuídense porque es duro y más cuando le pega a toda la familia. Nos tenemos que cuidar unos a otros. Dios los bendiga y échenle ganas.
Hi, my name is Talon. I work for the Boise, Idaho Contempo branch. They asked me to do this video just so I can express what's happening in my life currently with the pandemic and COVID-19. Currently, I'm not working because of COVID. My wife has contacted it, and so we're stuck at home right now, just making sure that she's taken care of and having to keep my kids away from her and myself as well. My wife works in the wedding industry. She was around 12 to 20 people inside a room, even though she was wearing a N95 mask and had gloves on while she was doing hair and makeup. She still came in contact with the virus. She didn't show symptoms for around 10 days. After that point in time, she started feeling a little bit different, and then we finally had a positive test that came through as well. So once that showed up, it was we were forced to stay at home. So like I said again, I'm here. She's locked in a room. She's in pain. We've had multiple trips to the ER. She was on stroke watch, one of them. And then keeping my kids away from her is definitely, one of the hardest bits. At that and not working. It's great that our company takes care of us and is allowing us to, be paid for some of the time that happens. But it's also one of those things where you want to be at work helping your fellow employees, and we're kind of leaving everybody shorthanded. So just make sure to follow your state guidelines and, just stay with your family and keep everybody safe. Thank you.
Hi, my name is Jason Garfoot. I'm the Senior Technical Advisor with Global Finishing Solutions. Today I'm going to talk to you a little bit about my experience with the coronavirus. When everything first came out, I didn't think a whole lot of it. Like many people have said, everything changed very rapidly. A close friend of mine had both of his parents that were infected with the coronavirus. Unfortunately, his mother did not make it through. So that really had a big impact on me. And then as things continued to progress, my stepmom was actually diagnosed with cancer. Right during the middle of all this stuff, so we couldn't actually go see her before her surgery that she had to have right away. So then it really started to affect me as far as how serious I should be taking this. I had to sort of quarantine myself to prepare to go see her, to make sure I wasn't around anybody, so there was no possible chance of infection. And just as we were about to go see her, I actually got an email from a golf course that I go to frequently, and they informed us that one of their employees was tested positive for corona, and that anyone who was in the facility should also be tested. We were taking every necessary precaution, social distancing, everything, but then that was very scary, as my fiance's dad was with, and then right after that he was actually with his grandpa, or his dad, sorry, and he had a lot of medical issues and things like that too. So it was a very scary moment for us. Luckily, the test came back negative. We were all clear. I would recommend everybody wear a mask. I know everything has become so political now, but the way I look at it, no matter your views on the whole situation, is if you're wearing a mask, you're helping other people, even if it's just putting their feelings at ease. And a mask isn't hurting you in any way. So do your part. do everything you can to keep this minimized. And even though you yourself might think you have a good immune system and you can handle it, there may be somebody really close to you who cannot.
Hello everybody, my name is Trevor Lidke, for the people that don't know me. I am an operations lead with Global Finishing Solutions here in Austin, and I'm here to talk to you a little bit about the COVID-19. Impacted me is my wife was diagnosed with breast cancer, and we were currently in the hospital having her operation done when COVID more or less became real worldwide known and the hospitals had gone on lockdown. The more I learned about it, and like I said, we were in the hospital and I seen the precautions they were taking and how it was affecting them. Now, once we were released, my wife was at home, unable to do a lot. I returned to work, and that's when the shutdown happened. Now my wife became very ill and had to go back to the hospital, and I was unable to see her for quite some time. Now, like I said in the beginning, I did not take it very seriously, but seeing how it affected my wife or could affect her and how it was affecting all the nursing staff and all that, I started to take it a lot more serious. I took a couple months, if not more, off of work to care for my wife and to protect her from me bringing it home. She has since returned to her current job in the nursing field as an RN, and she currently has to take care of COVID patients. And the stories that I hear that she tells every day of the precautions and what it does to the immune system and the body is not something to be taken lightly. So I'm asking everybody, for everybody else's sake, even if you don't take it seriously, consider others that do, and keep your distance, wash your hands, wear the mask if you want.
We all have loved ones that depend on us. We really don't know exactly how this virus could affect us or them. So now more than ever, it's time for us to protect each other. To take some very simple precautions for those that need us. And use some common sense to keep us all safe. It's clear this virus poses a risk to many of us and our families. So now more than ever, it's up to us to commit to following some very simple common sense precautions, such as washing your hands for at least 20 seconds or using hand sanitizer when washing is not available, such as social distancing by setting yourself at least 6 feet apart from others that are not in your household, such as wearing face coverings and face masks when you're out in public where social distancing might be difficult, and remembering not to touch your eyes, nose, mouth, and face. And also, staying home when you're sick and remembering not to come to work and to call in if you feel any illness symptoms. These are common sense precautions that really are effective at limiting the spread of this virus. By following these simple practices, both at work and outside of work, we all can do our part to protect ourselves and our coworkers, all of our families and loved ones, our jobs and our companies, our economy and our country. We ask that you please stay the course, remain determined, follow the safe practices, both at work and outside of work, to keep yourself and your families safe and successfully getting through this. Thank you.
Stay safe, everyone.
Thank you. Be safe. Be safe.
Thanks for being safe.